Welcome to the Skin Philosophy Edit with your host, myself, Annalouise Kenny. I'm here to bring to you the knowledge and skills to level up your business. We are speaking to industry experts across the industry to make sure that you're getting your knowledge in skincare, equipment, ingredients, and everything else you need to make sure you have the best of your business. Hi, and welcome back to the Skin Philosophy Edit with myself, Annalouise, and Faye Knox, who is a functional / holistic acne coach and practitioner. So thank you for coming, Faye. It's great to have you in to talk. You've been doing phenomenally with your treating acne clients, and I see it on Instagram the whole time. And I wanted to get you in to explain more about what you're doing and how you're doing that with your clients.
Thank you.
So what we'll do first is go through from the very start. So how you got into this industry, what made you decide to come into this industry?
Yeah, so it all started, I feel like it does for a lot of practitioners back in the teenage years when I started with acne. And my whole teenage life was just back and forth to the doctors, coming out with a new prescription for creams, antibiotics, the pill. And I felt like I tried everything at the time. And I got to the age of 20 and it becomes so severe. Like it was all up my cheeks, grade 4, and it was really affecting me mentally. And so I went to the doctors and I said, please refer me to dermatology. I want to go on Roaccutane. He was like, do you know the side effects and have you, learnt about it? And I said, I've researched it and I'm willing to do anything. So I waited 3 months and then got into the dermatology appointment, and I had to sign a disclosure, which is really scary to say, you'll come back every month to have your liver checked and you have to go on 2 forms of birth control because Roaccutane can cause like 98% of a birth defect, I think it is. So there I signed it and I thought, yeah, I'll just go on 1 form of birth control. So I actually was on the Depo-Provera at the time, which is the injection, and I swapped to Yasmin, which is the oral contraceptive pill, which is amazing for skin. So I was like, right, double whammy, this will clear my skin, 2 medications at one time. I was on Roaccutane for 5 months and then I came off it. My skin was so clear, it was perfect. And then I actually moved to Australia to travel. And then I read this book a year on in. And it was about repairing your periods and getting a regular cycle. And that's when I just discovered the impact of the oral contraceptive pill. And I started to think, okay, these low moods, irritability, brain fog, maybe this isn't me. And it's actually the pill I've been taking every single day for however many years, and then the injection beforehand as well. So I made the plan to come off of the pill. I had the chat with my partner and everything. And when I came off of it, my acne came back. It was just like boom, along with other symptoms. So going on medication and back on the pill just wasn't an option for me. So I decided to work with a naturopath, so like a holistic doctor. And she gave me this nutrition plan, lifestyle plan. And it was perfect. Like I did it for 5 months, I did it for a bit longer. I got to the 8th month and all my other symptoms that was triggered by coming off the pill, like hair loss, missing period, things like that, they started to return and balance themselves out. But my skin was still an issue. So I had my Instagram at the time, actually, because I started it when I started Roaccutane and I kept it as a private library for my progress.
Oh, wow.
And then when I moved to Australia and my skin was clear, I was like, there's no point in carrying this on. And then lockdown hit. So I reactivated the page and started to review skincare products and renamed it Faye Face. And I documented my post-pill journey on there. And it made me realise like how many other girls were going through it or wanted to take that jump but were so scared because they felt like they didn't have the support. So I documented my whole journey, and then I kept getting messages as my skin was clearing. Can you give me a consultation? Like, what should I be using? And I thought, right, when I get back to the UK, I'm training in this. So I came back, got a retail job at the same time whilst I did my training. Did level 2, level 4 anatomy. And then I started doing facials from my little one-bed flat. I just bought the massage bed, did that up, had no idea what I was doing. I was like, oh, I'll just use this and blah, blah, blah. And then right next door to where I was living, there was a wellbeing clinic and a room became available there. And I was like, okay, this is the chance to, take it on. So I thought, right, I'm just going to do it full time, jump in the deep end. And that's what I did. And I'm still in that clinic, but now I've progressed to the biggest room in there. And yeah, so I've got the clinic that's in person and then now an online clinic where I help acne clients heal from within. So taking a 360 approach really.
Okay, and so going back to the contraceptives, like for me, it's horrific that they don't warn you of this stuff.
Yeah.
When you were going through it at the time that, that it affected your body so much, like how did you feel of you were going, this actually isn't me? This is like, it could be a different person. Because it really can change your body, your skin, everything.
It really does. And that petrified me because this person that I always knew, I remember saying to my partner, like, what if I'm not me?
Yeah.
Like, how do I know who Faye really is? Like, what if I won't be the person you fell in love with and my friends liked? And he said, like, just write it out, see how you get on.
Yeah.
And the first symptom that I noticed was a change in my mood.
Yeah.
I used to wake up and I would have like this grey cloud above my head.
Yeah.
And I knew that I was in this like aggy, irritable mood that I could snap at any moment.
Yeah.
But I couldn't shake it off.
Yeah.
And I remember waking up and it was literally a week after coming off the pill because I thought, wow, this surely isn't happening this quick.
Yeah.
And I remember waking up and just springing out of bed, just felt so much light. And it wasn't until I was brushing my teeth in the mirror, I was like, I feel different. Like, what's changed?
Yeah.
And I thought, it's this. This is the beginning.
Yeah.
So all the side effects that came with coming off of the pill, and it doesn't happen to everyone. I definitely got the worst of it. All the negative side effects I accepted because I just knew my body had to go through this transition of eliminating all those excess hormones that I was putting in my body for years.
Yeah.
But the one thing I reminded myself was, if your mood is feeling better, that's all that matters.
Yeah.
Like, I'll take all the acne, we can work that out and fix that. I'll take all the hair loss. Nothing is worth me going back to how I felt when I was taking that pill.
Yeah, and you know what I learned lately, which it's one horrific that it's not been studied more, but ADHD in women, ADHD has been studied primarily in men, not in women. And the link between contraceptive and ADHD becoming worse, because basically what you have is your ADHD is the lack of dopamine reaching your brain, and that has got to do with a lot of estrogen.
Yeah.
So when you use something like the injection or implant, it's progesterone based, not estrogen based. So there's an impact on your dopamine again. So I've heard this from a person who's an expert in ADHD in women, and she was saying about how it's still not talked about or proven or anything like that, but how your ADHD would get worse just by contraceptive alone.
That's crazy, isn't it? Yeah.
Isn't it?
And I never thought of that, actually, even though the impact it has on dopamine and serotonin, all of the neurological disorders that it might be causing as well.
Yeah, exactly.
So, and it's so frustrating that the testing's always done on men because it's too expensive to be done on women.
Yeah, exactly. Oh, it's ridiculous. And she didn't even say it. So her words were like something she said. She was talking to me about ADHD, and she said something about your dopamine and your estrogen. And I said, so if you were on a contraceptive that was progesterone based, I said, how would it impact? And she said, well, there hasn't been enough studies done because of women, but she said it could definitely bring out your ADHD, because that's the first thing I went to. I was like contraceptives affect your hormones. So how would, and she said it definitely can, and it is shown that it can be more volatile, or that within your, so I had the same thing in my head. I was like, what if those years that I took the injection and implant, which was I think 15 years
Yeah.
altogether. What if I wasn't me?
Yeah.
What if I was what I could have been better. I could have been easier. I could have been, easier to handle, or it could have been more fun or more relaxed. Or what if that wasn't me? And like, it's heartbreaking because you go like that, and how they don't tell you.
Yeah.
Never mind how you felt about how you looked with breakouts and everything. It's like your whole body, your persona, who you are.
And I think it's easy to feel like you've been robbed of years, how many years you've been on the pill.
Yeah.
But what I try and remind clients is, look, you took it for a reason. And also, I mean, I used to get a lot of messages on Instagram saying you're so anti-pill and it's not right. And I was like, look, everyone's got their own decision to make. And actually, the pill has allowed women to go to work and go to university and get education and, things like that.
Yeah.
So it has its place in a way, but the issue is the lack of education around it and the lack of information when you're giving it from such a young age. I mean, when I first went to the doctors and I got prescribed antibiotics and then I went back again because lo and behold it didn't clear, I was 14 and my doctor gave me the pill. And I remember taking it home and saying to my mum, I don't want to take this. I'm not sexually active. And she said, well, don't take it.
Yeah.
And now I just thank my lucky stars that I didn't start taking it then, because I would have had so much more work to unravel if I had.
Yeah, exactly. And so then when you opened up, you had these clients, you were thinking of yourself as of your own condition that you had, and you've clients coming. How did you come around to the blood work analysis thing?
So I always knew I wanted to work from within as well as topically. And when I did my level 2 facial and skincare, I thought, right, I'll just do treatments 1 day a week and then do the rest online and do more consultations and get to know the client as a whole perspective. And then the clinic kind of just boomed. It got so busy. So I did that for a year, and then I did train in holistic health and nutrition as a coach. So that gave me like the first look into how to work with a client around that. And then more recently, in the last year or so, I've worked with a leading functional health coach to learn blood work analysis. So I have an online acne program now where the client comes to me and we have a thorough consultation. Like, I need to know everything. I ask about past trauma, stress, nutrition, lifestyle, period, poo. I need to know everything because it paints the picture of what could be going on within the body.
Yeah.
And then when the blood work comes back, it's not just a case of looking at the bloods and being like, oh, you've got low iron, take this iron supplement. I match it to the symptoms. So it's symptom analysis and blood work analysis, and trying to interlink it all and paint this picture of, okay, this is what's going on within the body.
Yeah.
So testing was what helped me to work on my hormones and clear my skin. So I always knew I wanted to go down that route and combine all of them. So yeah, it's a holistic perspective that I think gives the client the answer for me, because the skincare, the treatments are brilliant at managing acne, really good at calming inflammation. But if someone's got an underlying issue or concern, we need to address that.
Yeah, because it's all about what's coming underneath. And that's where it's frustrating for a lot of therapists, because they're trying to treat something like acne or rosacea. And like I always say, it's a symptom. You can't treat it. You only can get rid of the symptom. And that it will keep reappearing until you figure it out. So the blood work analysis is amazing to do, but must have been hard to study.
Yeah, and it still is. Like, I still have to refer to notes, and it takes me a long time. Like, I probably spend a whole day on analysing the bloods and writing the protocol, because you have to really fine-tune everything and make sure that you're not jumping to conclusions. So it's about, okay, these are all the worst case scenarios, and pruning that down, and then checking in with the client and being like, were you dehydrated? What were you doing this day when you had these bloods taken? Did you do it fasted? There's so many boxes that you have to tick. So it is time consuming, but it's brilliant, because you get that aha moment. It's like, this is what's happening. This is why she's having headaches. You know, this is why she's having heavy periods.
Yeah.
And then the skin always comes last. Like, we never talk about the skin.
Yeah.
Because it's all the other symptoms that they're experiencing that provide the answer, basically, alongside the bloods, which we iron out first.
Yeah.
And then bam, like, the skin gets the results.
Yeah. So I come to you and then you do a thorough consultation. You look at lifestyle, everything like that. You do the blood works. And then you lay out a treatment plan of like a course of treatments with this is what you should do in your lifestyle, like supplementation, meditation, or how do you like, because my biggest thing is trying to tell a client to relax. This is a lot to do with stress. You can't.
Stress is the enemy.
Yeah.
So my first 4 weeks within the program, so the program's 14 weeks. And the first 4 weeks, I lay what I call the foundations. So I always say to the client, you can't build a house without the foundations and the bricks. So we need to work on that first. And that includes mindset and stress, nutrition, lifestyle, so sleep, moving your body, and having your detox pathways open.
Yeah.
And then obviously skincare. So we lay those first. And the hardest one is always mindset and stress because everyone is just, you know, run down with it lately because of all of the stresses we have going on. And I always say to my client, what would you rate your daily stress level out of 10? 10 being the worst. And they'll say, oh, you know, I'm not that stressed. Works fine. Then as we get deeper through the consultation, lo and behold, they're eating 1 meal a day. You know, they're running a marathon every week in the morning when the cortisol's naturally at its highest.
Yeah.
And these are all the micro stressors that start to accumulate within the body and can cause that cortisol, the stress hormone, to be chronically elevated.
Yeah.
So when I say the word stress, I feel like we need a new word for it because it's not just like wanting to pull your hair out or in a traffic jam stress.
It's hypervigilant.
There's so many stresses. Yeah. Like the biggest one nowadays is scrolling on your phone before bed.
Yeah.
Waking up and scrolling on your phone.
Yeah.
The amount of stress that we are exposed to that we're not aware of, this is what is having a big impact on the skin, and it is the hardest to navigate with a client.
Yeah, like notifications on your phone, constantly being stimulated to look or think about something, not resting your brain, not, you know, taking time out. It's huge at the moment.
It is, and like it's the way the world's going.
Yeah.
So it's down to the individual to be aware of that, and that's where the education comes in. So in my program, I've got mindset and stress modules that they can refer to.
Yeah.
So for one, I'm not repeating myself, but for two, that they can access it at any time.
Yeah.
Because like you say, notifications, people wearing Apple Watches, like it's just buzz, buzz, buzz everywhere.
Yeah.
And then you've got work, holding the house, if you've got kids. There's just so many daily pressures.
Yeah.
And then you've got the intrinsic side of it as well, like not eating enough, not enough protein, processed foods and things like that. So there's a lot to consider.
Yeah. And do you find your clients are mainly just of acne, or then they start to come to you for other things then?
Yeah, so I have had some clients that have come to me who are wanting to come off the pill and want to try and reduce the chance of that acne coming back because they know that they went on the pill for acne.
Yeah.
So that's their biggest worry. So I've helped clients to transition off of it.
Yeah.
And I actually had a lovely message last week from a client who she tried to come off the pill multiple times and she just got scared and went back on it.
Yeah.
And we got her off the pill. She got one spot, literally nothing, and came back. And then she managed to fall pregnant and she's had a baby. So that's like such a nice feeling because she said, I would never have come off the pill and stayed off of it if it wasn't for your support. So I feel like skin is literally just the tip of the iceberg.
Yeah.
There's just so much more to like uncover and work on. And some of it is life-changing, like one client who's got really heavy periods that week of the month she has to block out of work, she can't go in, who is now, you know, don't even know when a period's coming because she doesn't feel it coming on. that is life-changing.
Yeah.
And then the skin clears because we've worked on the hormones. So,
Yeah.
there's so many
aspects.
different aspects, which is just really lovely to see.
Yeah, it's nice to be able to get those results, especially in such conditions, such circumstances that is like very hard to do anything with. You know, like who would they turn to say, I want to come off the pill, or, you know, I'm worried, like help me, because GPs aren't great with I'm in pain, or, you know, that kind of way. So it's great to have you to be able to kind of go, please help me with that. It's good.
Yeah. I just wanted to become the person that I felt like I needed. So
yeah,
hopefully I'm doing that.
So PCOS is a condition that many of our clients may deal with. What are some key things skin therapists should know about managing acne related to PCOS?
So I always think it's important to set the expectation with the client, because if the client doesn't know about the complications of having a hormone condition and how it impacts the skin, they might expect just to come to you and buy a 7-step skincare routine and have a few treatments, and then lo and behold, their skin's clear. So it is down to the practitioner to communicate effectively and be like, look, I can help manage your skin, but with PCOS, I don't know if you're aware that, you know, it's a condition that is lifelong, but you can get your symptoms into remission. So we have to do a bit of internal work as well. Always work within your qualifications, super important. You have to be ethical in what you're doing. But I do believe there's so much free information online now that if you really wanted to be an advanced skin practitioner and like really show your client that you're willing to help them from all aspects, go online and get some basic generic information on PCOS and make a PDF. And hand it to those clients that put PCOS on their form. Because the more that you advise on diet, so like getting your protein in 3 meals a day, managing stress, balancing your blood sugar, you're going to get better results as a practitioner as well. And you're going to get better client retention, and they're going to be happier because they're going to have more of a sustainable result.
Yeah, because PCOS is difficult because it's something that you can't really treat until you want to get pregnant if you go through a doctor. It's like very, it's manageable, something like that, but we can't actually, unless you want to get pregnant or something, then we can really help you. I've a good few friends that suffer with it, and there's not much they can do with it. Through a GP or through medical.
Absolutely not. So I missed that part. When I came off the pill, I got diagnosed with PCOS. And you have to take 3 out of the 4 criteria, which is amenorrhea, so absent period. So if you haven't had a period for 8 months of the year, or 8 or less periods, I think it is, sorry. Clinical signs, so like your acne, hair loss, things like that. High testosterone on the blood test, and then actual cysts on your ovaries. And I ticked all 4 out of 4. Now, that was due to coming off the pill. And I've managed to get my symptoms into remission because I've changed my lifestyle. Yet, when I went down the route of the GP, and it's not their fault, right? It's
the way they're trained.
Yeah, it's the way they're trained. It's such a old, historic way of treating people. And they've got like how many patients to see per day. So come back when you're ready to have a baby. But then what can happen is women get frustrated because they want that baby now. Yet hormones, like what you do today, impacts your hormones in 3 months' time. So there's a lot of work to be done. So it's a lifelong condition, but I definitely think it's important people know that they can get their symptoms into remission.
Yeah, and they don't. Like, they really don't. And it is all about, like, how you look after your diet and what you intake and how you treat your body. So how do you handle budgeting and financial planning? And do you have any advice for skin professionals managing the financial side of their business?
Budgeting is something I could definitely work on. I'm a bit of a magpie when it comes to like courses, you know, things like that. But I actually use a banking app called Monzo,
Oh, yeah.
which is brilliant.
Really?
Really, really good. So you can set up your budgets on there for each category.
Yeah.
And if you pay for the Monzo Pro, which is literally £5 a month,
Yeah.
you can set your own categories. So I've even got a coffee category on there, which I overspend on, always overspend on coffee. But it's nice to have that in there.
Yeah.
So yeah, budgeting it's really useful for that.
That's such a good idea.
Yeah.
Yeah.
And it gives you a notification. It pops up and says,
Stop spending.
you're about to spend over your coffee budget. Stop going to Starbucks. And I'm like, ignore, delete. Cappuccino, please. So yeah, that's really useful to have, and just having an oversight of that. But I think when you're first starting out, you just got to get a taste for how much things cost.
Yeah.
Supplies, skincare, consumables.
Yeah.
And then, I mean, I kept adjusting my budget for months when
Yeah.
I first started out.
You never truly fully get it. Sometimes the suppliers will give you an average costing per treatment, which helps a bit, but everything is always changing. And then you need sometimes more consumables of something and more less another month. You know, it constantly changes. But the most important thing is to be on it, to know. To like know what you're spending, know what you're going to make, because if you don't, then you're in the dark.
Yeah. And it's a business at the end of the day. As much as it's our passion, you can fall into that quite often and think like, oh, you're just treating friends in clinic. And it's like, no, you need to make money from this. This is a business. So regularly checking in and having your spreadsheets and seeing what profit you've made at the end of the month, and having your targets as well is really useful, because it's easy just to get, in the hamster wheel of the job.
Yeah.
And not have those regular oversights and check-ins with your own finances.
Yeah, I do think it's important, because I think if you don't keep focused on that, you can't offer the service, because you end up in a position where you can't afford to offer the service because you're not making enough money to make ends meet for yourself to actually survive. So you have to have an idea. It's not about wanting money. It's about keeping yourself it's stable and happy. So how do you continue to grow and learn as a businesswoman and skin therapist? Are there any resources or practices you recommend for others?
I love networking. So any event, anything like that, I'm there, because I think it's really good to be around people that are like-minded to you.
Yeah.
If you really want to grow in what you're doing, you've got to be surrounded by those kind of people. And then things like podcasts, love podcasts, books, always reading books. And like I said earlier, I'm a magpie for a course.
Yeah.
Always looking at new courses, how to expand my knowledge really. But because I'm very science-led, I always look at the newest research papers as well. I think that's really important. So if I'm on TikTok or Instagram and I see something, I think, not heard of that. I always try and get a backup with looking at
Science Direct or something like that. Yeah.
PubMed, things like that, because you can't just take everything you see online.
No.
You can't. You have to be you have to filter through it and double check that it's coming from a reliable source. Yeah. Because your client may come and ask you about it, so you need to have the answers as well.
And how do you deal with that? Because you're very good on Instagram.
Thank you.
So how do you deal with a client coming in and saying, this person down the road said this, and you're just like, that person isn't qualified, doesn't have a clue, but how do you go, ignore that?
I just say, look, if you're paying me to advise you, listen to me.
Yeah.
Like, don't waste your money on coming and paying me to tell you what to use on your skin and what to do if you're not going to listen. It's like going and paying for a PT and then walking out and going, I'm not going to listen to that. I'll go and listen to Bob down the road. Like, it makes no sense.
Yeah.
So I don't work with clients who are already working with someone else, like a nutritionist or a dietitian or anything like that, because if I say, go and do this, take this supplement, and they're working with someone else that's saying, take this supplement, it's just not going to work. There's too many cooks in the kitchen.
Yeah.
So that's where you have to have your boundaries and set the rules and be like, look, this is how I work. If you want my advice, listen to it and only my advice, especially with holistic health,
Yeah.
or go elsewhere, basically. You have
Yeah.
to be a bit cutthroat.
Yeah, I completely agree, because I think we can tend to be like, oh yeah, it's okay. And if we really set our boundaries, then the client has more respect for our advice, and they appreciate it more, they listen to it more, and it's really important to do that. And sometimes we're scared of setting those boundaries because we're scared of that the client's going to run away,
Yeah.
and it's like, so what? When I had the clinic in London, I remember a client. So if a client came in for a skin condition, I would always say, you can't do the treatments without doing this products. Simple as that. You have to do the skincare products. And one client was like, well, I don't want to. And I was like, if you want to treat pigmentation, if you want me to treat your pigmentation, you need to use the products. Simple as. And she was like, well, I'll go somewhere else. And I was like, well, go somewhere else. Yeah. Because like, you're only going to moan to me when it doesn't work if you're not using the products and the treatments. Like, if it doesn't work after I said what will work, then fair enough. But if you're not even going to listen what I'm saying at the start, okay, bye.
Yeah, that is not a client you want, is it? Because at the end of the day, it's going to fall back on your results and your reputation.
Yeah.
So.
And word of mouth, because then they'll be like, it didn't work.
Exactly.
So, what were some of the biggest hurdles you faced when setting up your business, and how did you overcome them?
Mine were mostly internal. So, imposter syndrome, massively when I first started. I remember my first week, and this client had travelled over an hour to come and have a facial by me. And she sat on the bed. She had grade 4 acne. And I remember sat there thinking, what the hell do I do? What do I do? Like, what do I say? So we had the consultation, and in my head I'm thinking, I'm just going to tell her to go to the doctors and get antibiotics. And I was like, Faye, this is the reason why you're doing this job. She has seen you online. She trusts you. You need to be confident with this and trust the process. So gave her a skin plan, gave her a treatment plan. Lo and behold, skin cleared in 6 months. So it took that to start gaining that confidence, because when you're in any new industry, you're going to feel like a fish out of water, aren't you? So it's just that repetition. It's like growing a muscle. The repetition is what's going to bring the confidence.
Yeah.
And then the more confidence you get, the less you feel like a fraud or an imposter.
Yeah.
Especially at the start, when like you're like, okay, that's £80, and you're like, I don't even know if I've done the right thing. It's so nerve-wracking, but every time, I will say it, like I still get it to this day, every time I start a new venture, you get this a bit of imposter syndrome where you think, am I meant to be here doing this? I don't feel comfortable. But you've just got to grow through it.
Yeah.
It's good that you feel that way, because that's when you know that you're making a change and you're about to grow.
Yeah, exactly. The uncomfortable is where the growth is.
Absolutely, yeah.
Yeah. It's nice though, like, I love the new stuff. And like, there is that kind of, oh, is it going to work or whatever? But creating something new, starting a business, like, it's great excitement, and it's best to like focus on that, not about, how maybe I won't know everything, or maybe, that's, we all tend to do that, overthinking, over worrying, and it's like, focus on how enjoyable, but because this is the easiest part. Opening it is the easiest.
Yeah, and what you want to do as well, because I feel like another hurdle that I experienced was comparison.
Yeah.
Like, Instagram's amazing for finding out the latest treatment and things like that, keeping up to date. But you go on there and you see a new treatment, you think, I should have that in my clinic. But it's a pigmentation treatment and you're doing acne. And it's like, no, drown out the noise and focus on what you set out to do and your reason why you started this. I think that's really key and important.
Yeah, never compare yourself. I was only talking to one of the students yesterday about this, because she was like, I'm just worried that they won't, they'll look at the other people in the area, and I was like, don't think about the other people in the area. Just focus on yourself.
Yeah.
Do what you want to do, and do not, like the rabbit in the hare situation, like, just focus on your own goals and forget about everyone else. You don't know their story, you don't know their path. Stay in your lane, concentrate on yourself, don't worry about anyone else.
So important.
So looking back on your journey, what is the one piece of advice you'd give to other skin therapists or professionals who are thinking about starting their own clinic? So they're going to set up, they're thinking about opening. What would you say take into consideration when opening?
I think what helped me the most was having a niche. So having acne is like my thing, because it doesn't mean that you'll do that forever, but what it allows you to do is to speak to your ideal client. So anytime I posted online, I was speaking to my ideal client. Like, I'd painted this client as like, she had a name, places where she was going, gyms she was going to, and then I'd go online on those profiles and follow those people that like following the Pilates class and things like that. So that helps from a marketing aspect as well, and getting your clients through the door. But then as soon as you get those clients through the door and they have a good experience and they go and tell the cousin and the sister and the friend, you will start to get people that don't particularly have that concern anyway. So I would say in clinic now, I probably treat 30% of acne clients, and I'm an acne specialist. The rest are all word of mouth referrals that, you know, love the experience, love the results at the end, but they don't particularly have acne.
Yeah.
So don't worry about having a niche and feeling like, but that's just one funnel, because it does lead you to other avenues as well.
Yeah. I think that naming your person, like creating your person, having an idea who your person is, what your exact person is so important.
Oh, yeah. It helped me a lot, because to begin with, I saw it online. I was like, this is woo-woo crap. I'm not doing this. Like, imaginary friend? No. And then I did it. And actually, that's when the clients started coming through the door, because I was talking to a specific person.
Yeah.
So when they were on my Instagram, they were like, oh, she's talking to me. Like, that's me. Book.
Yeah. And because you were that person, it made it, the passion from that came across. You could identify with what those type of people were. So it made it even easier from that. So I do agree with niche down, but a lot of people are scared to niche down because they're scared they're narrowing the market.
Yeah, exactly. But I think it's the best thing to do. It allows you to concentrate on one thing and not get, you know, overstimulated, or, you know, your brain clouded with other things. It does help you just to narrow it down to begin with, definitely.
Yeah, definitely. Okay, so did you want to ask me a question?
Yeah, I suppose that links, the question we've just had ties into this. So obviously, being a successful businesswoman, what are you laughing for? That. You are in our eyes. Do you have multiple ideas like run through your head daily or weekly? Because I talk to a lot of practitioners who have a lot of ideas, and myself included. But how do you focus on that one thing and know it's the right decision?
I think I don't focus on it focuses on me. The stuff that is meant to work keeps coming back, and the stuff that doesn't falls away. So there's loads. There's some that you look and go, absolutely not. It would take a complete new company to do that. It would take a different direction, a different team, blah, blah, blah. Absolutely not. Stuff that's in our remit, we will do that. And there are 4 or 5 other projects that are in the pipeline at the moment. I think the biggest, most important thing is, what do I know that I will come across, I know best at? What's my expertise in? How is that sticking? So for example, we have multiple ways we can develop. I can franchise clinics. I could franchise training centers. I can build a skincare company. I can build an app. I can develop treatments, sell equipment, and all of these are all things I could potentially do. But what's the most thing that will represent me most? So like, for example, building an app will make online education more accessible across the world.
Yeah.
That's my bag. Like, education is my bag. skincare, I know skincare ingredients inside and out, but I'm not a formulator. And there are many other people, and that what it would take to get to there is not really what we have at the moment. Is just the basic stuff to develop a proper skincare that everyone goes, oh my God, it's changing the world. There's too much. There's too many people. Why even bother? Like, it's this, when I was saying India and Dubai, I went for India because I saw the potential there. It identified with me more. And Dubai was done. Everybody is out there. There's hundreds of clinics. They're all, they don't want to pay for education. I went and looked there and I was like, and everyone said to me, because India is very close to Dubai, everyone said, why didn't you do Dubai? And I said, I looked during lockdown. And I was like, no, that's not my market. That's not my, and it isn't exciting for me to just come in and be another school in a place. How do you pick? So, but it is a thing, I've heard this before on one of the podcasts, is you think of an idea, you leave it sit for 2 weeks, and if you come back about it and it still excites you, then it's something you should go for. But if you find it falls away, it falls away.
Yeah.
Like, and sticking to what you know, and don't try and, go outside. You can go outside your remit a little bit, but it's like, if you really want to develop as a huge, like, big business, you want to make sure that you're the best in the game. And that's like, it's the same thing, niching down. It's making sure that you know exactly. Like, I did the clinic in London. And obviously the clients love it. They're raging we closed down because they still come in to be models in Clapham. But it wasn't my biggest thing. The clinic in India, I have the staff there who are doing the treatments. That's their thing. They love it. I love running the business. I love setting up a business. I love educating staff. I like doing treatments every so often. I don't want to have a clinic. I'm letting them do that. They have the clinic.
Yeah.
I'm having sometimes a bit of treatments here and there, but the education, teaching them how to have a clinic, that's my thing. So I think it's, looking at what you really want from life. It's like a student will come and they'll go, oh, I want to do this because I want flexible, easy life. I want to get into this industry. I want more flexible hours. Or someone will go, oh, well, I want to create a big, huge clinic and employ loads of staff. And I'm like, if that's what you really want, do it. But make sure you're doing it for the right reasons. If you're doing it to have a business, don't. Because it's never don't ever set up a business to have a business. Because you'll never grow from that. You have to let it grow for you, and then it becomes into business. And it's so much harder to have a business. You know yourself. You've no cutoff. There's no end. It's like having a child. It's always there. Never goes
freedom.
away. No freedom. You can't go on holidays. No such thing. Like, there's not, I think, Christmas Day, that's like, absolutely not.
Yeah.
Not even look at my phone. I don't care. You can all blow up. Like, I'm not, it's, but you can't switch off. Like, there's no off from it. And that, to have something that you can do doesn't mean you have to have a big, huge business. Doesn't mean you have to have a big, huge clinic. Just something that makes you happy. And if it grows into something else, like you're starting to grow into something else now, it develops naturally.
Yeah.
And go with the role. Don't go, well, I'm going to have this down, like, it's like it comes to you naturally. It doesn't come as I want to make loads of money out of this. I really don't agree with that way of living or thinking. This is a great way of making money. It's no other option. Like, me having 9-10 schools, it wasn't an option. It wasn't me going, oh, well, do I take this step or not? It was, I have to do that. That has to be open there. This is the next one. It just grew naturally. Yeah. And I think that's probably the biggest thing. Let it grow naturally. It'll take you.
Yeah, that's so true. Because I imagine when you started out all those years ago, you weren't like, right, I'll open a clinic in India. in India. So yeah, it's like one door opens, it leads you down another path, doesn't it? Yeah. So yeah, it's so true. Thank you.
So any other final tips for the people on listening to the podcast that you would suggest?
I think just remembering the reason why you started the clinic or the business, the skincare business, because it will get hard, it will get really tough. And like we just mentioned, a lot of people start a business for freedom. It's complete opposite. Like, you get tied to the clients.
Yeah.
If you're booked up, you're booked up 3-4 months in advance. You can't book anything then. So though having freedom is something that is a big challenge that I came across, and I was like, okay, this is not what I expected. But also, like, the hurdles with clients. So you'll get the difficult client that will be in and, like, say, my skin's not changed, and it'll be challenging. You'll get, like, the tax bills that are unexpected. There's so many things that crop up that you think, do you know what, I'll just go back to folding t-shirts at Marks and Spencer's. So much easier. But if you recircle back to that reason why you started, everything else doesn't matter. You just find a way to navigate through it. So that is something that I remind myself, in those times when you need it, is like, well, why did I start this? Why am I working this 12-hour shift today? It's because I wanted to provide a service to my clients and change their lives. So I think that's really key, and it's a good tool to have in your toolkit, when times are tough.
And the thing is with clients, like, sometimes it's nothing to do with you. Like, you will not be the only person who has a complaint or a moan from a client. Like, but sometimes it just has nothing to do with you. It's how they're feeling. And sometimes it can be portrayed in a more upsetting way or non-upsetting way. But don't take it to heart. Like, that you're the only person, or am I a terrible therapist or something like that. These things happen, and as long as you have the best heart and want to do the best things, it'll come across.
Absolutely. So important to remember.
Thank you so much for coming, Faye, the whole way down here.
Oh,
it was great to have you, and
me.
I'm sure that everyone listening will love everything you were saying. And it's great to see how the specialities coming across, like, specialising in acne, specialising in one thing, doing the blood work, incorporating everything. You're doing brilliantly with it.
Thank you.
Thank you. Thanks.